We're going to work House Bill 2280. Is there discussion, comments, questions? Representative Ardenberger.
Thank you, Madam Chair. I have an amendment. Scott, I don't know if you want to put it up on your screen.
Sure, I am happy to.
Do you want to explain it?
Sure.
Thank
So
you.
the amendment would strike a couple of items from the list of issues that the Board of Pharmacy is to address in rules and regulations prior to January 1, 2023. You can see that on the page I currently have displayed. This would strike from those requirements the distances from the nearest pharmacy where a telepharmacy outlet may be established, and possible exemptions, and the maximum number of prescriptions that may be dispensed by a telepharmacy outlet. So those would not be issues that the Board of Pharmacy would be required to consider in adopting rules and regulations for telepharmacy outlets. The other part of the amendments is in the definition of dispense, which is now displaying on the screen. It would clarify that dispensing could include delivering prescription medication to a patient by mail, common carrier, personal delivery, or third-party delivery to any location requested by the patient. To clarify that dispensing doesn't have to happen in person at a physical pharmacy location, would allow things, or would clarify that things like mailing prescriptions is a permissible practice.
Thank you. I am bringing this amendment forward from when 1861 testified on behalf of their client. So this was in their testimony.
Comments, questions, or well, let's get a second on the amendment. Seconded by Representative Parker. Comments, questions, Representative Barker. Did I call you Barker?
For the carrier of the amendment.
Parker.
Are you limiting the number of satellite pharmacies in your amendment?
I don't believe so.
Okay, that was the question.
Further questions or comments? Representative Lynn.
Thank you, Madam Chair. I'm going to guess that to remove the distance from the nearest pharmacy is so that we could have mail order prescriptions. My question is, how does this affect the controlled substances? I'm not sure what the other mail-in pharmacies do with controlled substances. Are those allowed to be put through the mail?
I do not know.
Is Alexander with us? They're not with us today. Something tells me they are not, but I can't confirm that, Representative Lynn.
I would want to make sure that they are excluded, controlled substances, at least to the point where packaging, that it's, what's coming through the mail, so that it's not distinguishable from anything else as far as it being a medication.
Ida? Ida,
Oh.
are you available?
Yes. Yes, Madam Chair.
Could you see if you could get hold of Alexander for us, please?
I will do so. Thank you.
Thank you.
I just want to comment. I currently, with my healthcare, I get my prescriptions mailed to me because it makes me do it that way. And nothing in there does it state that this is a prescription, or but granted, I'm not getting those controlled substances, but.
So what did you just bring up for us, Scott? Was that you?
Oh, that was not intended. I'm just trying to find some guidance from the pharmacy.
Okay, that's fine.
They have
That's
any
fine.
materials on this topic?
All right. Representative Kelly.
Thank you, Madam Chair. Question I have that just came to mind: would these changes, eliminating the distance and the number of prescriptions, have any impact on locally owned pharmacies? I mean, could it provide more competition to them than what they currently have, or provide any advantages that would really hamper them in their business? I mean, a lot of small towns have one or two locally owned independent pharmacies.
Representative Arnberger.
I do not have an answer for that. I'm sorry. I'm looking through some information that was sent to me from 1861 to get more clarity, but I will.
Well, and I'm going to go ahead because I do allow to have the experts to come to the mic when we're working on bills.
Okay,
So
thank you.
Mitch, if you would step forward, tell us who you are, who you're with, and see what you can answer on this.
I appreciate it, Chair. Mitch DePriest with 1861 Consulting on behalf of the Kansas Association of Chain Drug Stores. I believe I had testified to the experience of the National Association Boards of Pharmacy when they were considering whether or not to include these distance requirements in their national model legislation, and decided not to for a number of reasons, including experiences in other states that did not see a decrease in traditional pharmacy locations. I hope that clarifies. Let me know if you have any other questions.
Does that answer your question, Representative Kelly? All right, Representative Epley.
I just want to clarify, because I get to write the bill brief. The number of prescriptions is not restricted then, once and for all. There's no limit.
I think so. I don't know.
Maybe Mitch wants to comment about that, or Representative Barker, I don't know, whoever knows.
If you're, no, I get all my prescriptions through the VA, which mails. I mean, I would have to drive to Topeka if I was going to come in person and get my prescription, because they don't have an outlet. Well, I guess they have one in Wichita, but not in Junction City. So I just order all of mine on mail, in the mail, and
Again, in the amendment, it strikes 34 and 35, and I assume that refers to no restriction in the
No
number.
restriction.
Mitch, do you want to respond to that, please?
Yeah, the language being stricken was reference to the putting a cap on the number of prescriptions a telepharmacy outlet could dispense.
There's no restriction.
Yeah. Are there further questions? And we'll see where we get Representative Lynn with the pharmacist. Further questions on the amendment?
Madam Chair, this is Alexandra Blasi. I apologize. I was listening in, but I did not have a WebEx link till just a moment ago. I'm here for any questions that you may have.
All right, thank you very much for doing that. Representative Lynn, would you please restate your question for Alexandra?
Yes, thank you, Madam Chair. My question concerns controlled substances and if they can go through the mail and what kind of regulation there is if they do.
Yes, controlled substances are currently permitted to be mailed. The important feature with mail order is that the packaging is completely de-identified from any indication of what is in the container, and that includes the patient information, that it even is a prescription. And of course, packaging has to be appropriate for the type of medication. So if it's a temperature controlled medication, those requirements are made. I will note that mail order pharmacy is permitted now. So the change from the amendment that I have seen would not make a difference to that. However, the third parties that would be permitted to deliver would not have the same restrictions or constraints because those third parties would not be registered with the board.
Madam Chair, follow-up question?
Yes, ma'am.
So the new pharmacy outlets will also understand that they cannot identify what's inside their packages?
The telepharmacy outlets actually they dispense directly to the patient at that outlet location. So it's a brick and mortar pharmacy. There would not be any mail order contemplated by the telepharmacy outlets. I think just from listening in on the conversation, by removing the maximum minimum distances and the maximum number of prescriptions, essentially it opens the door for no restriction on the location or the degree of operation of that telepharmacy outlet. So they would be able to be opened anywhere, including a metropolitan area with a competing pharmacy right next door, And they would also be able to do whatever volume of prescriptions they wanted. So one technician in that telepharmacy location could do hundreds of prescriptions a day if they were able to do that.
Okay, thank you, Madam Chair.
Further discussion or comments on the Arnberger amendment? Representing Arnberger, you may close.
I close.
All right, you've heard the motion by Representing Arnberger on her amendment, seconded by Representing Parker. I got that wrong earlier. All those in favor signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. Back on the bill. All right, and then I believe that we've got one, Alexandra, that amendment that you had. All right. And Dave, did we send those out to the committee? Dave Long?
No, we did not. I didn't have copies of them.
All right. So Scott, if you'll take and bring those up on the screen, I'd appreciate it.
Yes, Madam Chair, that's what is displaying now.
All right. Alexander, would you like to explain those, or you just want to have the reviser do it?
I'd be happy to, Madam Chair. Yes, they're consistent with my testimony. I believe this page that Scott's got pulled up right now references the maximum number of attempts that an individual would be able to take the pharmacy practice and law exams. And per our discussion, instead of allowing the board to set that number, we're just suggesting that the maximum number of 5 attempts be directly inserted into the statute there. And then the other amendment is to the language regarding the dispense as written. Unfortunately, in our redraft, we did not properly provide allowance for a prescription by oral order. So the dispense as written wouldn't be written on a prescription that is coming in by oral order. So we just want it to be clear that the indication for dispense as written would be either on the prescription or when communicating that prescription by oral order.
All right, thank you. Representing Epley?
Thank you, Madam Chair. These amendments are coming fast, and so I would move for the amendments as presented for the 5-attempt limit on the certification test, and then the DAW, the dispense as written language, as presented by Ms. Blasey in that amendment.
Motion made by Representing Epley, seconded by Representing Parker. Questions, comments on the amendment? Representing Reese.
On the average, how many times does it take to pass the exam?
Usually once.
Over 75% of the individuals that attempt the exam in the state of Kansas pass on their first try, which is consistent with psychometric evaluations for a validated exam. And so that's a good showing. I don't know the exact specifics as the number of attempts move out, but we have not had to exercise the 5 limit on any individual in the state of Kansas over in the past 6 years. So this is those individuals where the states do not set a limit, and then those individuals pass after 5 attempts and would be able to reciprocate to the state of Kansas.
Thank you.
Well, and I think one of the examples you used was someone in another state that took them 13 times, and they would be able to be licensed in Kansas if we didn't limit this. Representing Ellis.
Is this 5 times in a year or 5 times in a lifetime, the test?
It would be a lifetime, so it is a total maximum number.
Thank you.
Are there further questions? Representing Barker.
This would be for the vice chair. How often does a doctor give an oral prescription to the pharmacist? And if so, how is that documented?
Well, I'll do the best to answer that. I can only say that it's diminishing remarkably with electronic records, and also in light of desire for accuracy in penmanship and all of that. But Probably once or twice a week, I'll call in a prescription for someone when I'm not at my EMR, and they take my order, and I spell it all out to them verbally, and then the pharmacist receives that order, writes it down where they work, and then they can dispense the med. Now, there are certain controlled substances that you are no longer allowed to call in, of course, but for other routine prescriptions, you can phone those in. So as far as, you just have to communicate, it's just standard methodology of what you call in every time. Thank you.
Thank you, Madam Chair.
Further comments or questions? Representative Epley. You
I
may
move
close.
my amendment. I close.
All those in favor of the Epley amendment, seconded by Representative Parker, signify by saying aye.
Aye.
Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. Back on the bill. Representative Epley?
Thank you, Madam Chair. I would like to move that we pass out House Bill 2280 as amended.
You've heard the motion by Representative Epley, seconded by Representative Parker. It's because those cupcakes are over there by him. I'm thinking of the cupcakes. To advance House Bill 2280 favorable as amended. All those in favor signify by saying aye. Aye. Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. All right, next on our agenda committee, we have, we'll open up the hearing on House Bill 20, or working, not hearing, but working House Bill 2281, establishing and implementing the 988 Suicide Prevention and Mental Health Crisis Hotline. Questions, comments, discussion? Representative Berquist.
I believe we all received an amendment in an email this afternoon, and want to know if the body wants to consider that.
Discussion, comments? Scott, do you have that?
The proposed 988 amendments.
From the telecoms?
Madam Chair, I have the email that was provided to the committee. Given when I received it, I was not able to prepare it into balloon format for the committee to see, but I am aware of what is in that email, yes.
All right. Can you put that page up on the screen for us? Is that possible?
I believe so. Let me.
Okay. We just don't have copies of it here, so.
And Madam Chair, if Scott would go through it with
well, it's not his amendment to go through. He didn't draft
right.
it.
Okay. I'll be glad to read through it. It's not my amendment either. But.
If you want to explain what the amendment is, are you offering the amendment? Because if you're not offering it, then we can move on.
I don't understand the amendment enough to offer it, other than to offer it as for consideration of the whole body. So I will offer the amendment for discussion.
All right.
And so I'll make a motion to consider.
Second? Is there a second? Representative Kelly seconds. Are you able to get that up, Scott? If not, we'll have to have someone get copies down here to the committee.
It should be up now, Madam Chair.
All right, it is. All right, now that doesn't have the explainer on the right-hand side of the screen, does it?
So I'm not sure if it's sharing, but it should be on the left side. I have the comments.
Oh, there it is.
Yeah, that should be the commentary that he has provided.
Oh, there we go. Okay. It's on the right-hand side for the printed copy, but it's on the left-hand side for the
Sure,
So
not
would you,
confusing
would
at
you
all.
care, would you like to explain to us what this actually does, Representative Berquist?
I will read the author's explanation. And it implements a fee change mid-month for wireless providers. No, that's not a description of it. Pardon me. Every billed service user shall be liable for a 988 fee until such fees have been paid to the exchange telecommunications provider, wireless telecommunications service provider, VoIP service provider, or other service provider. All providers shall have the duty to collect the fees and imposed pursuant to this act. And the fees imposed by this section shall be added to and be made separately stated in billings for the subscriber account. If separately stated in billings, the fees shall be labeled 988 fees. A provider may combine the fees imposed by this section with the 911 fee imposed by KSA 125369 into a single fee to be collected from the customer. If a provider elects to combine the fees, the combined fee shall be identified as to the customer as a 911-988 fee in billings for the subscriber account. If a provider elects to collect a single combined fee as provided in this section, such a provider shall report to the department on the form prescribed underneath the message just popped up on my screen.
Is there anyone from the telecom industry that's available for comment? Because when I start looking at this, we're on one page and we're striking words and we're inserting words. There's about 1, 2, 3, 4, 5, 6, 7, 8.
Yep. Yeah.
9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, at least 22 amendments. You have someone from the tele industry, Representative Bishop.
I'll get to it eventually. Madam Chairman, thank you. I am uncomfortable dealing with this without having something written in front of me. I'm sorry, I'm having a very hard time reading it. What would be the next step? You're really good at knowing when it goes to the Senate and what can be done in the Senate and so forth. Is there another bite of the apple for the telecom industry to be a little more clear in what it is that they want to add to the bill?
Well, there's always another bite of the apple because once a bill has left this committee, then it goes to the floor. It can be amended on the floor, and then it can be amended in the Senate, and then it goes to conference, and we work out what the differences were between the two bodies. So there's at least 1, 2, 3 more bites.
My suggestion, Madam Chair, is that we defer this and let them catch up with it as it goes through the rest of the process.
Representative Berquist?
Acceptable with me. I'm very, very new to this. I'm just a messenger boy.
All right. So would you like to withdraw your amendment?
I just did. Yeah.
Is that all right with the second for him to withdraw it? You know, I think the thing that was frustrating for me was it's not like this was a bill that wasn't sitting out there on the calendar. They knew it was in this committee. It was pretty obvious that this bill was going to be work. It's one of the most important bills out of many to help us in the area of behavioral health that states get to do. And it was a lot of hard work on the federal level to finally get to this. And for an amendment of this magnitude to come in, I know that when one of the, it's outside.
What's outside? Oh.
That the Jared, and I don't remember Jared's last name, who testified. Huh? Keegan? That, you know, he made some mention of, you know, perhaps them not being acceptable to the idea of the fee that's in this bill, the 50 cents on here, being used for other services outside of basically the infrastructure. And one of the things that in this bill, and I think, I brought that up when we talked about the other day on page 3, when we talked about on lines 13, 14, 15, to fund uninsured services provided in response to the hotline. If an individual receiving the service is uninsured or the services or the facility are not covered by any individual's insurance, et cetera. So it was obvious if you've actually read through the bill, that services are going to be provided with this fee. And I believe Representative Berquist, where the folks that provided you that amendment are coming from, is that they don't want it to pay for any of those services. I think it's really difficult for any state. And we do have, if we want further explanation, we do have KDAD's, Andy Brown's online with us to explain what the federal government in their legislation is allowing to be these fees to be spent on. And I do have a lot of faith in what Andy's worked with on this bill, that if you can have a 988 suicide hotline, or as we learned yesterday, it will also be used for where you have the behavioral health side and you have the IDD side. So we could have two different sets of mobile crisis units, being sent out depending upon what the situation is. And so if we can't provide the services, there's no point in having the hotline. Representative Ellis.
So where they spend the money is followed by or regulated by federal guidelines?
Andy, can you elaborate on that a little bit more? Because I think it's what they are allowing us to spend it on, and then what KDADS has chosen to spend it on, which has a lot to do with services. Andy?
Yeah, thank you, Madam Chair. I'd be happy to try to address that. So the federal act that authorizes the state to collect the fee also defines the use of the 988 funds that are collected by the state. And so in section 4.2, there's a paragraph there that talks about the use of 988 funds. And it reads that, and I don't know can I share my screen while I'm in here?
If you know how to do it, don't ask me to do that. I wouldn't have a clue what to do.
All right.
I always have
just
other
didn't know
people
if I
help
was
me.
authorized to, but I will bring
Oh, you're
this up.
authorized to do that, Andy. Yes.
Okay. All right. Let me bring it up. That way folks can see it on the screen. So this is the language, that I cut and pasted right out of the federal act. And you can see that it says that a fee or charge collected under this subsection shall only be imposed, collected, and used to pay for expenses that a state, that would be Kansas, is expected to incur that are reasonably attributed to the two following expense categories. The first one, A, is ensuring the efficient and effective routing of calls made to the 988 National Suicide Prevention and Mental Health Crisis Hotline to an appropriate crisis center. And I don't think there's any disagreement with the telecom industry that that's one of the intentions of this bill. The second one is B, the personnel and provision of acute mental health crisis outreach and stabilization services by directly responding to the 988 National Suicide Prevention and Mental Health Crisis Hotline. So what we are hoping to be able to do here in Kansas with this fund is modernize our response to crisis services that come to the attention of the 988 hotline. This is important because we want 988 to be the front door for mental health services and IDD services across the state. This would allow us to fund the positions needed to staff our teams, to make sure that our routing of those services is timely, and that we are getting those services available statewide. Kansas ranks 51st amongst all the other states and the District of Columbia in access to mental health services. And that is a very sad state of affairs for Kansas at the current time. I do believe that this bill creates an opportunity for us to really focus on how we might be able to modernize that without using state general funds. And I feel like it's important to note that these funds would be attributed in a way that would be distinct. They would be collected as a fee fund. The uses of them as defined in the bill would be limited to what's defined in the bill. And I think that creates a lot of flexibility for how we look at our state general funds for mental health in the future. One of the challenges that I think we oftentimes find in Kansas is that we have more need than we have funding available to assist with. And that's a thing that the legislature constantly has to struggle with. And I appreciate the work that you all do on budget issues. But we oftentimes underfund mental health as a result of that. And our efforts over the interim with the Mental Health Modernization and Reform Act, Reform Subcommittee, I think really highlighted the need for this front door service and the accessibility issue that is plaguing our state. I feel like this could have a real and significant impact on that, and I would hate to see this legislation be limited to just funding the 988 number.
Representative Ellis, does that answer your question? And it's not that, it is always that mental health is underfunded. And for any of you that have sat on appropriations, it has always amazed me, and I've got at least 10 plus years with that social services budget, and it amazes me the food fight that we basically have when that budget comes in, because those are all high ticket items. But people would rather fund other things than that. Representative Barker.
Thank you, Madam Chair. I'll play the devil's advocate. Andy, there is a process for social service.
Is your mic on, hun?
My microphone's on. Blue light's on. Andy, are you there?
Yeah, I can hear you.
Okay, good. I think it's a worthwhile cause, but there are funding mechanisms that come through the state legislature. We fund your agency. You can always come in and ask. What we're doing here is circumventing the funding system the way we normally do it and putting another tax on every individual that has a cell phone in the state of Kansas. And you're talking about 50 cents per phone per month. Most families, the average family has about 5 phones, and if they have a house phone, it's 6. So it's a significant tax that you're putting on when just because the state hasn't funded you properly. And I agree, they probably have not. And I was on appropriations also, and I understand where the committee chair is coming from. But also in this statute, it's a leap of faith for at least me, because we're giving you the money and we don't have anything in statute. We don't have anything in statute.
Excuse me, just a minute, Representative Barker. Someone's got their microphone on. Please turn it off, whoever just coughed. Go ahead, Representative Barker.
And it's kind of open, and I was hopeful that we would come up with something after the ID and DD presentation about their mobile unit, that we would have something in statute, or at least an amendment in statute, that would say, okay, this is what you can spend the money on. And you're going to have a dual purpose here. You're going to do the IDD portion as well as the suicide prevention portion of it. Or cut the fee, because you're going to get $3 to $5 million. That's what the projections.
Representative, that number is actually $20 to $25 million.
$20 to $25 million?
Yes, sir.
Then I'm a little shocked at that amount. Then, I will tell you up front, I will be against this bill. And I just can't see it. I was thinking the suicide prevention said their annual budget was less than $1 million, or around $1 million. And then we're going to give you an additional $25 million without you going to your budget committee and presenting your arguments of why they should approve an additional $25 million. That's the funding process. That's what the legislature does. And by attaching a fee on every phone owner in the state of Kansas, and in most cases, probably 6 times what you're assessing, the 50 cents, because there's average of 7 phones in a household, and $25 million, I think that's where you go back to your budget committee and you make your arguments there, not here on a fee. But that's my argument, and at some point in time, I will tell you, I will be opposed to this bill.
Representative Epley.
Thank you, Madam Chair. I really appreciate the comments of the representative from Abilene, and just want to explain being on the receiving end for many, many years where we have so-called mental health services available in Kansas, and you open the door and then there's nothing there. And that's what this bill provides. And it's not subject to the vicissitudes or the ups and downs of the budgetary process of our legislature, which is always an ongoing challenge and an issue through appropriations. This provides guaranteed services, and I really appreciate Andy bringing this to us so we can do this. We can provide for these teams for IDD and these teams for mental health to be available. If not, guess what? When times get lean, what do we cut? I mean, none of us will probably be here. Very few of us will be. We'll probably cut that. So this is because it's subject to appropriations, and it's a 1 or 2 year deal, and then, baby, it's gone. And guess what? Then we don't have those teams. You open the door, nobody's home. Nobody's there to take care of this. Mental health has been so starved for so long in this state. I'm offended by how Kansas has conducted itself, being in the emergency room, seeing these people, and not being able to do anything with them. The ERs become de facto mental health units. Your jails become de facto mental health units. Because guess what? There's no teams to respond to these people. This is our chance. This is our opportunity. And I would kindly and very respectfully disagree with my colleague from Abilene and say this is our chance. Now, maybe we need to reduce that fee. Maybe it needs to go from 50 cents to 40 cents. I don't know. Let's look at that through the process as we work this bill. But I don't think it's asking too much to finally have guaranteed mental health services available to the patients of this state. We have historically underfunded and been unavailable, and this is our chance to finally have a guaranteed response team and to have a unified presence for mental health in this state, and I, for one, do not want to miss it. So thank you, Madam Chair.
May I respond, Madam Chair?
Yes, Representative Barker.
Well, let's just put on a $25 fee on every phone in the state of Kansas and fund the entire services. That would be no difference. And Doc, I appreciate it. As a district court judge, I saw all of that. And I realized that people that should be in treatment sometimes go to jail. And I'm an advocate for mental health services. Central Kansas Mental Health serves my area very well, and I work with them all the time. But there is a mechanism. It's called government and how government works. And you come in, the agencies come in, they go to their budget committees, they work the budget committees, then they go to appropriations. Now, and that's the way it's worked since we became a state. And now, because we have cell phones now, it's just an easier mechanism to say, oh, we'll just put an extra tax on a cell phone. And we'll pay for what government should be paying for.
Representative, you say that it works, and I would opine and say I respectfully disagree. It has not worked. It doesn't work at all. You come and spend 3 o'clock in the morning with me in the emergency room taking care of someone that's overdosed on medication, and we can get no placement for them in a mental health facility. So we keep them, keeping other people out of the ER that need our services because that bed is occupied by someone that can't gain services. The system does not work. Fees do work. This is a guaranteed fee. Yes, it's dedicated, and it does. It circumvents the appropriations process. I'm ready to do that. It's time to do that. The way the system's worked in the past has failed. It has not worked, Representative, and it's time that we have a dedicated funding for this, and we can do it through a fee. We can absolutely do it legally. It's outlined in statute there, and it's time we did this. It's egregious that we're 51st in the United States for mental health services. We can really change this now, and I hate to miss this opportunity, Representative.
And I don't disagree, but we're 48th in the salary for judges in the United States. So I could argue that point, but I go to the Judiciary Committee and the Appropriations Committee and argue for more money for the judiciary. I think they're underfunded. But I don't come in here and try to put another $2 on my phone bill to pay for, to get the judiciary back up to number 34, that's where they were when I retired. Now they're at 48. But, you know, we could just run fees all day. But there is a process, and I disagree. I think, you know, the judiciary is underfunded, mental health is underfunded, but we do have elected officials, a representative government that comes in and respectfully takes the folks' tax dollars and spends them. Now, whether we spend them appropriately or not, that's debatable. But if this is a slippery slope. When you start adding a fee here, well, you know, why don't we add another fee for another issue that we think is underfunded, like the judiciary or some other agency. It's just a bad precedent. And thank you very much, Madam Chair, for your indulgence.
You're welcome, because I can relate. Andy, with the way that this would work, you're not bypassing the appropriations process, are you? So the budget process would still show these funds, where they're being spent, what they're going on, and they could still be approved or disapproved by the appropriations process. Would that be correct? So we would have accountability on all of this. You're muted. You're muted. No, he's trying to get his mute.
There we go.
There we are.
All
All right. No,
Okay,
Andy
so-
will answer questions. He's good at that.
Yeah, so, yes, we have a requirement in the federal act that the state, any 988 fees that are collected by the state have to be reported to the FCC, and all uses of those funds have to be then reported to Congress by the FCC on an annual basis. So every dollar of this will be tracked and reported. There won't be any lack of accountability for how the funds are used.
But I didn't hear you talk about it going through our appropriations process for our legislators to vote up or down, or say that, no, you didn't spend enough over here, perhaps this is where it would be. So can you elaborate on that, please?
Yeah, so all of our fee funds that we receive, the gambling funds, the lottery vending machine funds, all of those go through the legislative budget process.
Does
And this
that
would
help
be no different.
Does that help, Representative Barker?
Question for Andy?
Yeah, that's fine.
You show those in your budget request, which may give an opportunity for that budget committee to say, well, you really don't need as much as you asked because you've got this fee fund coming in. And that budget committee will rely on the fees that come in, and then possibly will fund you less from your budget the year before. Isn't that very possible? They're going to say that you get, what, $25 million for this? And they'd say, well, you're just getting $25 million now of fees, so we'll just fund you less 25. You know, that's the way legislators work.
Well, I think you're going to see it broken down, Representative Barker, because I have had conversations with Andy of, you know, some of the items that would, you know, be spent on this. So we would basically see not what we would technically refer to as line items in the budget process, but we can also require them in order to report this stuff to us on a certain basis. I think the legislature would be going backwards and be doing a disservice if they were to cut any of their currently existing funding that is out there for some of these programs. And
I agree that would be wrong.
well, but it can be done. I mean, like I said, you know, you can ask Representative Carpenter and even Representative Ballard, because Representative Ballard and I have fought side by side for a lot of years on the social services budget, and it is gut-wrenching to watch all your work and your recommendations to be cut for other programs in the state of Kansas. I've got several. All right, I've got Representative Carlson. You got your mic. Is your computer volume on? Oh, he's got it. Never mind. You're good.
Thank you, Madam Chair. The last 2 years I was on the
Social Services Budget
Thank you,
Committee.
yes. And it was the people that came in and everything was needed. Everything was needed. And then it doesn't go through the budget or we get sent home early or whatever takes place. But there was never a way other than going and asking for money that we could get the money. It had to come from the state. And being from a family that has 6 cell phones, what we're paying for 6 cell phones, if I can't afford $3 a month more, I shouldn't have a family of 6 cell phones. I think it's an excellent way. And if one of those people with a cell phone, if it prevents a suicide in their family or a suicide of a close one, I don't think anyone is going to complain. Does that happen to everyone? Thankfully, God, no. But this is one way that we can really address and see clearly what it goes for and that it will be there. And I'm highly in favor of this. Thank you, Madam Chair.
Representative Reese.
Thank you, Madam Chair. I think what Representative Barker, I believe Representative Barker wants to see the 988 number. It's just how the money's being used. Am I correct? Right. To have a family of 4, 6, whatever, 10, and pay 50 cents more for them. And if I especially have young people on my family plan, I want them to have that number available. I have the suicide hotline number on my phone, and I tell many people to do that. It'll be so much easier with the 988 number, and I know we have to do it because it's a federal thing anyway. But because mental health services have been, the funding has been cut, but for so many years, they can't even catch up. They're not even at the probably 208 where they should be from 2008. So it takes specialized, when I think about, I was questioning about the crisis teams yesterday because I can envision in my head what these teams look like. I used to be on those teams. And it takes specialized training. And if you want to attract people that really like to do crisis services, these are folks that have a higher level of license. They have probably been in mental health for many years. They're going to command a little bit of a higher salary. But you can't just throw anybody onto those teams. You have to have people that are specially trained. And now, with having, thank goodness, being able to combine the intellectual disabilities, people with those kinds of disabilities, that's going to even take even more specialized training. I think that we will see a big bang for the money, and I realize it's a huge, it's a lot of money. My heart's dancing thinking about what the mental health center systems, the intellectual disabilities, what they will be able to do with that funding and enhance their services and be able to have crisis teams that respond, just quicker than what they're able to respond now, and being able to help those in the ER, and relieve all of that, what it takes in the ER, and hopefully have more beds at our state hospitals if we need those. I agree with Dr. Epley. We've got to take advantage of it now because who knows when we're going to see this again. Thank you.
Representative Arnberger.
Thank you, Madam Chair. My question is for Scott Abbott. Does it state in the bill, does it state per phone number for the 50 cents? And the reason I ask is because at work, we have 2 phone numbers, but when we switched when we switched it over to Cox Communications, they now assigned each phone a phone number. So in the end, only 2 phone numbers that we put out there, but if we're going to be taxed on all 10 lines on top of that, so I'm just curious what it actually states in the bill.
Sure. So Representative, the bill speaks to 50 cents per month per subscriber account. And this is largely based off of the existing 911 fee language that's already in statute. And I believe that, and I'm trying to find the definition here, but I believe the way it is interpreted is that would be each phone number on an account would be assessed the fee.
Okay, because then on top of it, I was just thinking about all the hot spots that we have on the company plan. Those are also have phone numbers, even though nobody calls that number. All the tablets have phone numbers, so forth. So that's going to add up a lot. Just throwing that out there.
Yeah, so I just pulled up the definition from the Kansas 911 Act. Like I said, this language was based in large part on the existing language and statute for the 911 fee, and it describes subscriber account as the 10-digit access number assigned to a service user by the provider for the purpose of billing a service user up to the maximum capacity of the simultaneous outbound calling capability of a multi-line telephone system or equivalent service. So that's how subscriber account, and that's the terminology used in this bill, is defined.
Representative Bishop.
Thank you, Madam Chairman. I would just like to point out that on page 3, starting with line 13, it says, no, I'm sorry, line 16, C, section C, at the beginning of each legislative session, submit an annual report of the hotline's usage and the services provided in response to calls to the hotline centers, and right now there's only 2 in the state, we're going to need more, to the House of Representatives Standing Committee on Health and Human Services, and the Senate Standing Committee on Public Health and Welfare, or any successor committees. I believe that the 988 number is so greatly needed. If we don't have a good, solid crisis line that people can call, what they're going to be doing is dialing 911. And too often that means that people are responding to that call, meaning well, doing the very, very best job they can. I can tell you that in Wichita, every single year we have 1 or 2 suicide by cop. We have people that whose families have called for help, and instead the individual ends up dead. There's way too much of that happening. And this is a way to provide services, to get those referral onto follow-up services, and to have an actual, vibrant, responsive system that can take care of some of the most heartbreaking situations that can, with this passage of this bill, can be saved, cannot happen. In other words, lives can be saved, families can be saved, a great amount of sorrow, and communities can be saved, the devastation that this causes within a neighborhood. I first became involved with the mental health issue from attending neighborhood meetings in Wichita, where the police came to talk to the citizens, and a lot of the discussion was around mental health needs in that neighborhood. And I suddenly woke up to see the recognition of how much we are not finding answers for these issues. And this is a wonderful answer. It's nationwide. It will be backed up, and we will have full reporting every single year of how it is progressing. Thank you, Madam Chair.
Representative Berquist.
Thank you, Madam Chair. This particular issue, the 988 addresses, is as critical of a specific issue that we could look at, and we could feel and we can see the need. One of the greatest problems is that we, as our chair said, year after year, we ignore funding, or we don't get specific requests for funding appropriate to address these issues that are critical, that were critical last year, that were critical 10 years ago. And what we do is we turn it into something we can palatably accept, and that is just a little fee on a bill. And what prevents us from the next critical need, whether it be education or roads or any other major thing that we have a hard time getting funding for, let's just put another fee on it. And we will still tax at the same amount of rate across the state, almost guaranteed, but we'll have that other tax and that other tax and that other tax. We need to start addressing real problems by holding us as representatives accountable, and that's to the public. We will be no more aware as a public that there is a need for a crisis hotline like this if they just get a fee on their bill. They'll swallow it like a horse pill and go on, and still won't know because the need got filled by the people that really provide services, and the people as a whole won't know why that was even needed in the first place until their family is affected. I agree with the representative from Abilene that it's not that it's not a need. It's just that it's the quick fix way to do it, and is it the right way? That's for this body to decide. Thank you.
Representative Turner.
Thank you, Madam Chair. Yeah, I just wanted to chime in as well. I recall back to testimony, and I raised the question of where did the 50 cents come from? And it seems that the answer was, I think it's just piggybacked off of the 911. I didn't seem like there was any budget-based, structure to that, which caused me concern then. And I guess I thought that I would see some things more on that before the debate. But, and then to add to some of the other comments, when 911 came, I thought it was kind of the end all. It's that one single simple number. But I never thought there might be a 922 and a 933 and a 944. So I don't know how many more of these we'll see. Absolutely. Nobody in this room have I heard speak against the need for this. I think it's the question that's been raised is the cost. Is it just an automatic 50 cents, which I hear equates to $22 million? Or, should it not be based in some level of justified service that we'll get for that, rather than give us that money and we'll find places to spend it? So with that, thank you, Madam.
I can guarantee you we're not just finding places. Those spots are already there. Representative Lynn.
Thank you, Madam Chair. Just to follow up with what another representative said, I also had questions about the phone lines that are being used for other equipment, and if those would also be given a fee. So any of from what the revisor said, it sounds like it's going to have a line that has a calling capability. So I'm thinking that's the distinction between a regular phone line and something that's used more out in the field or whatever else you use phone lines for. So I wanted a little bit of clarification on that. And then also, I think if we are skipping kind of the regular budget process, I think some of us are concerned with I think we all agree this is important, but I think we would all like to see what exactly we're funding with how much money. That's what we do when we're going through the budget process. We see how much money is going for specific items. And so I would like to see something broken down for it seems like there's some ambiguity in the bill for what all would be actually funded. Is the 50 cents appropriate? And that's what I would personally like to see. Thank you.
Well, and I think it goes back to what Andy said, and correct me if I'm speaking out of turn here, Andy, is when the Appropriations Committee looks at fee funds, we can see all that detail. And we don't necessarily come in legislation and specify this is what you will spend it on. Because tomorrow, something could become obsolete and you've had to shift where you spend it and what you spend it on for whatever reason. Or it may be a terminology issue. But we always look at, as far as appropriations, is what's in those fee funds and where that money's going and how it's being spent. And I don't see this as being treated any different.
May I ask a question then? So This will then all be looked at and broken down in appropriations, even though it skipped social services budget.
Well, it's not going to skip the social services budget because you're going to see these dollars in those line items. So like, for example, let's say it goes to a CCBHC, you're going to see those funds. So you're going to see, here's your all funds, here's your SGF, and here's your fee fund money.
Okay.
Because it's very possible that they could have 3 lines. I think what would be shameful if the legislature is, and I think that Representative Barker alluded to this, is if they came in and said, okay, here's your all funds, forget your SGF now, we're just going to let you have the fee fund. Taking out that SGF would be absolutely shameful because we still have an obligation to this. And we've heard the discussion a little bit on, well, we're charging a fee for this, a fee for that. And someone made some comment about schools, and I'm thinking about all the taxes that we all pay in schools. And we keep hearing people scream for more taxes. And we're talking about a 50-cent fee here on this phone line. Does that answer your question?
Yes, and I agree, and I completely support this. I think it would make us all feel a little bit better.
Right. Well, and I am not taking, and I think Representative Reese alluded to this, I am not taking, and I don't think anybody in this committee is taking, that the opposition is to the subject of what we're on. It comes down to dollars, and whether we like it or not, that's a big part of what we do here. So, Representative Barker.
Thank you, Madam Chair. And I agree with my colleague who spoke last about there's no specificity here. Where these monies are going to go, we're going to say, here's $25 million, run the suicide hotline, which costs less than $1 million. But the other $24 million, just use it. And I like accountability, but I'm just doing some calculations here. If we do 50 cents, it's about 25 million, I was told. So if we did 25 cents, it's about 12 million. And if we did 12.5 cents, roughly, it would be about 6 million, which is 6 times more than they get now. And it's a starting point. And so I would look to my colleague who offered this bill to be worked, Dr. Epley, or Representative Epley. Would he be amenable to an amendment to reduce it to 12.5 cents, brings in $6 million next year? We'll look at it and see what their needs may be. But that would be a question to my esteemed colleague.
Representative Epley.
Thank you, Madam Chair. I'm not really prepared to dig into all the studies on how much the monies are going to cost, and I can't tell you today how much the response teams are going to cost. I don't think we know that. And to the point that, we need to look at have accounting for these services and going forward. And this is a fee rather than a direct appropriation like you and I think of, and I get that. I think an amendment that's honed to the services requested in the bill is certainly something we need to look at. And I would hope that through the collaboration with the other chamber and through the conference committee process that we could work this out. But I'm not ready to say today that we'll amend this to 12.5 cents a line as of today. Gosh, 911 is 80 cents, I think, and I think this is for each phone, so I think this is a pretty important fee also. And I think 50 cents is a starting point. I mean, we might find that just with what's outlined in this bill, it might be more than 50 cents. We might not be getting such a good deal. But I don't know that without further work, Representative.
So that's a no, correct?
That's a long no.
Thank you. That I have not changed my position. Thank you.
Hey, Andy, if you'll pull down your screen sharing, because I think it's affecting identifying who's speaking, so thank you. Andy, would you've been around this process quite a few years. Would you like to speak to what you've just heard here the last few minutes on the funding issues?
Yeah, I'd be happy to. So for the majority of the history of the National Suicide Prevention Lifeline, there was a Soul Crisis Center here in Kansas that was headquarters, and you've heard testimony from Monica Kurz as a representative of that agency. And for the majority of that 50-year history that they have been in operation, they have not received state general funding. Just within the last 5 years, we've incrementally started increasing their state general fund dollars through the regular process. And currently, out of their $1 million budget, only about 100,000 of that comes from the state. In addition, the ComCare Crisis Center that's currently in operations is not funded through the state at all currently. So when it comes to the amount of SGF that we're spending on the NSPL now, we're only spending about 100,000. And when we start to look at what the need is and how that impacts things, I think there's an assumption maybe that the $1 million that they have to operate now is sufficient to answer all of the calls to the NSPL. Last year, KDAS was awarded a grant from the Vibrant organization in New York that operates the National Suicide Prevention Lifeline to try to increase our in-state answer rate because it had dipped below 60%. That means that 40% of the callers in Kansas that called the National Suicide Prevention Lifeline, their calls were not answered here in Kansas. So we have a gap that we are trying to address with that grant, and we were recently able to increase our answer rate here in the state to 70% over the last year. But I want to emphasize that we still have a long ways to go in terms of getting from 70% to 90% answer rate in the state. And there's a real sense, I think, that we want to be able to do more than just answer the phone. And we want to be able to make sure that those folks are connected to services that they need in their time of need and not have to have them wait for services. So that's the intent behind this legislation.
Are there further questions, comments? Representative Arnberger.
Thank you, Madam Chair. My question's for Scott. In this bill, does it state anything about funding the suicide app that was passed that the Attorney General has in their budget? I don't know if that could maybe, if that's even discussed at all. I know that there was an app and the Attorney General asked for funding for it and it was cut out of his budget.
I would think you'd start crossing budget lines, so you'd be dealing with the KDAD's budget versus the Attorney General's budget.
So does all of this just go to KDAD's?
It's dispersed through KDAD's, right? But that doesn't mean it doesn't cross other budget items. Would that be correct, Andy?
Yes, we currently work very closely with the Attorney General's office. Their suicide prevention coordinator, Gina Meyer-Hummel, and I meet frequently, and we work jointly on suicide prevention projects. So while the mobile app that she's working on is youth-focused, there's no reason to think that if we came up with a statewide suicide prevention program, we wouldn't be able to support the work that the Attorney General's office is doing.
Okay, I just know that was, in the budget, it was for $50,000. And so I'm just thinking how to fund all of that as well. Thank you.
Yeah.
Further questions or comments? Okay, I've got a few amendments. I know that surprises everyone. The first one, and I don't know if we sent these out, so perhaps Scott, you could bring them up on the screen. The first one will be what I refer to as the lockbox. We know how lockboxes work, but we have to attempt them anyway. And if you would explain how this works, Scott, please.
Sure, Madam Chair. So the amendment would be what I would say is standard special revenue fund lockbox language that already exists in statute for a number of other special revenue funds in the state treasury, providing that the monies in the fund shall be used only for the purposes allowed or set forth in the section. So those expenses are already listed in the bill. In fact, on the page that this amendment would appear, that's the subsection D that kind of describes the expenditures that are allowed. The additional language would just clarify and kind of reinforce that the monies in that fund will only be used for these purposes and for no other governmental purposes.
Thank you, Scott. Do I have a second for my motion?
Second.
Second by Representative Epley. Discussions or comments on the amendment? Representative Barker. You're
My
getting
only
your
comment.
quota today, I
Well,
see.
We all know that that's as good until the next legislature. Any legislature could change that at any time. So when we talk about these lock boxes, they're good for maybe a year and a half until the next committee or the legislature in general just says, oh, we'll forget about that. Just like we do with our 7.5% balance in our budgets. We forget that every year.
I would agree. Further comments or questions on it? All right, seeing none. On the landwear amendment, seconded by Representative Epley, all those in favor signify by saying aye. Aye. Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. Now, the long one, Scott, on page 6, following line 22, if you can bring that up, please. And it's a lengthy amendment, and correct me if I'm wrong, Scott, but it's language to add a 50-cent per retail transaction on prepaid wireless. Is that correct?
Madam Chair, that is correct. The amendment is lengthy because it takes a lot of the language that exists for the 911 prepaid fee, kind of the administration and how that's assessed on retailers and the documentation requirements and verification of those sales and making sure that the fee is being properly assessed and remitted. So yes, the net effect is to impose that 50 cents per retail transaction for prepaid wireless service for this 988 fee. And then copies a lot of that language about how that fee is actually collected on the retailer side.
I think it's always scary when we see a long amendment and then we find out it just does one little piece in there. Is there a second on the landwear amendment?
Second.
Second by Representative Epley. Discussions, comments on the amendment? Representative Smith.
Thank you, Madam Chair. Looking at the fiscal note that for the original bill, they were estimating 2.9 million accounts. Do we know approximately how many prepaid accounts there are and what that would do to the revenue?
We don't. That question has been given to KLRD, and they're trying to research it, but it wasn't something that they could pop up for us by today.
Okay.
Because they were just asked about it yesterday. But hopefully we will have that number by the time it goes to the floor. Representative Parker.
Thank you, Madam Chair.
I don't know what the Barker deal. I think it's because he's
freshman
got
year,
all
I
the
kept
cupcakes.
wondering why they kept trying to call me up to make announcements on the House floor for Fed and State. So I think one of the benefits of adopting this amendment, like any fee or tax structure, is if we pull more into it and we discover as money is coming in that perhaps it takes us more than the estimated 20 to 25 million because we've added these. This might actually give us more room to then come back and lower it from 50 cents to 40 cents or 35 cents in the future by having a broader pool.
Well, and I need to add something that I did forget. So there is two things that this amendment does. If you look, yeah, don't go there, Representative Epley. If you look at section 7A and B, it specifies that there would be a fund created for CCBHC centers, clinics. So it does do two things. I misled everyone on saying it only did one. Representative Parker.
Would that serve to provide some of the state general fund revenue or state funds as opposed to the federal matching then in CCBH? If we advance our, I'm mixing up my acronyms here. If we advance our bill to create federally recognized BHCs, that's the part that always gets me.
I practiced a long time.
Would this fee then provide some of the state money towards that federal match? or could it?
No, it could, because the thing that we're running into is, and I think that you've seen is the fiscal note on that is setting for the CCBHCs, if we had all 26, is somewhere between 43 and $70 million. And everyone's getting real nervous about that fiscal note that we have out there. So this would at least help us, because you're going to see us offer up, in order to reduce that fiscal, to phase in our CCBHCs, which is not what we wanted to do, but it's better than not advancing them at all.
Thank you, Madam Chair.
Okay, I'm going to give you a quota. No, go ahead, Representative Barker. You're fine.
Help me out here. So there's an additional $2 million because we're going to get the prepaid phones.
I do not know what that fiscal note is.
Okay.
Research is working on that for us, and that was going to take them a couple of days. So by the time we get this to the floor, we should have that by next week.
Okay. And just help me out. The CC what?
Certified Community Behavioral Health Clinics. It was a bill that we worked, 2 weeks ago, I think?
So part of this fee from the prepaid would go to that?
All from the prepaid would go
All
to that.
would go, the $2 million or whatever?
No, we do not know what that amount is at all. I know it's more than $2 million.
Okay. All right.
I suspect I don't say I know, I suspect it is more than $2 million.
Thank you, Madam Chair.
Further questions or comments? All right, seeing none, all on the landwear amendment, seconded by Representative Epley. Thank you. All those in favor signify by saying aye. Aye. Opposed, no. The ayes appear to have it. The ayes do have it. Motion carries. Now we're back on the bill. Now, Scott, I think that we had some issues on another attempt that we were trying to make. I've kept Scott rather busy, and I know that he's got more than just the health committee. But when we're working bills, I kind of dominate his time a little bit. We discussed yesterday about the possibility of an amendment to identify in this bill that we would indeed fund mobile crisis response services for IDD, and also that we would fund mobile crisis response services for BH. Have you figured out how to do that yet, Revisor Abbott? I gave him a lot this last week.
So, Madam Chair, this would be specifically the 988 fee that already existed in the bill, correct?
Yes.
Sure. So what I referenced earlier in the bill itself on page 6 sets out what monies credited to that fund may be used for. We could simply add 2 additional paragraphs or 2 numbered items under that list. This is subsection D on page 6. We could simply add 2 more numbered items under that list that describe the mobile crisis response services for the IDD population and mobile crisis response services for behavioral health in that list, and that should accomplish what you're trying to accomplish.
So what line would that be on, Scott?
So probably following line 18, because under that subsection D, you have the 1, which is the administration of the fund itself, the 2, which is the costs related directly to implementing and maintaining the hotline, and that's the capital letters A through E. So at the end of that list, I would suggest adding a 3 and a 4 that include the 2 items that you have described.
That's exactly what I would like us to do. So that would be my motion on this amendment. Is there a second? Seconded by Representative Kelly. Questions or comments? Does everyone understand what we're doing? No? We are emphasizing that the mobile, and get my terminology down here, the mobile crisis response services, which if you recall yesterday we heard a bill on the IDD. Well, we also have mobile crisis response services for our behavioral health as well. And I think you heard Representative Reese kind of explain this, is that what will happen is with this 988 number, a crisis call comes in, and it may be that the IDD crisis team needs to disperse rather than the behavioral health team to disperse. Questions or comments? Representative Ellis.
IDD?
Intellectually development disabilities. Is that right, Nick? Yeah, there we go.
Thank you.
I don't know why I flubbed that, so that's why I think the IDD just makes it very simple for me sometimes. So, further questions or comments? And that's the bill that we heard yesterday. All right, seeing none, all in favor of the Landwehr Amendment, seconded by Representative Kelly, signify by saying aye. Aye. Ayes appear to have it. Ayes do have it. Motion carries. We're back on the bill. Huh? Yeah, we don't need. Parker's laughing at me over there. I don't know. We may have to have drinks afterwards. All right. Revisor Abbott, I'm going to put you on the spot. Do you feel like we've covered everything that you and I talked about the last 2 days?
Madam Chair, I do believe so. If your intention is to pass this bill out of committee as amended, I would just request that you give me some leeway to make technical adjustments. I would appreciate the opportunity to consult some of my colleagues who staff the utilities committees to make sure that the fee language is kind of how they would expect it to look, to make sure it doesn't differ too much from the 911 fee language. So I would request that you include in your motion, or whoever makes the motion, if any, includes some leeway for me to do that.
So does that need to be a motion, or can I just authorize that?
Up to you, Madam Chair.
Oh, I get choices. Okay, this is good. All right, unless there's objection by the committee, we'll authorize the revisor to make the technicals and everything he needs to do. And for freshmen, this is not unusual when you've got something of this magnitude to allow that leeway for our revisors, because they want to make sure they're crossing every T and dotting every I as they progress through this, which is what we all want. So it's not unusual to allow that authority. Any other questions or comments on the bill? Representative Epley.
Thank you, Madam Chair. Because of the substantive changes we've made in 2281, and I know we passed it out, or getting ready to, I hope, but do we want to see the final written draft with all these amendments in it tomorrow or Friday, or would you rather not wait? Thank you, Madam Chair.
Well, I think, we need to give the revisor the opportunity that he needs to do this. I think the only amendment we didn't have in writing, and perhaps, Scott, you could draw up the last twos that we did on the mobile crisis and get that language out. You could just send it to Dave, and he can send it out to everyone. If there is an amendment that you didn't get a copy of and you want a copy of, or it's not up online, don't hesitate to give my office a call, and we'll see that we'll get it. And if that doesn't work, go ahead and get hold of Verida with KLRD, and she'll be happy to help you as well. Now that I put her on the spot out there, but she's always been very responsive and taking care of this committee. So, further questions or comments or discussion on House Bill 2281? I'd entertain a motion.
Madam Chair, I would move that we pass House Bill number 2281 as amended, the three amendments outlined and presented favorably for passage.
Motion made by Representative Epley and seconded by Representative Bishop. Is that correct? I'd noticed your hand had been up a few times, so I did want, because you've done a lot of work in there with the mental health, so I appreciate that. All right, you've all heard the motion by Representative Epley, seconded by Representative Bishop, to advance House Bill 2281 favorably as amended. All those in favor signify by saying aye. Aye. Opposed, no. Ayes appear to have it. Ayes do have it. Did the noes want to be recorded? Huh? All right, division has been requested, so all of those in favor signify by raising your hand. All those opposed signify by raising their hand. 1, 2, 3, 4, 5, 6 noes. Motion passes. All right, committee, let's see if we can get this next bill out, and if not, we will be back in here tomorrow at 1:30. We have House Bill 2373 that we heard yesterday with the dealing with the IDD population, as you heard. And I think that, is there questions, discussions on this bill? I do have an amendment here, is because of the action that we have taken in, all right, Revisor Abbott, can you, all right, if I understand what we've done here with this amendment, this was to take care of the FTE unclassified position, is that correct?
That is
Where you come,
part of
page
that
2,
amendment.
line 24?
Yes, that
Yes.
is that first kind of sentence that's added on that amendment that you have.
All right, so this would be, if you'll recall in the bill yesterday, is there's an FTE position required to have an IDD coordinator on this. So we've been able to reduce the fiscal note on this bill from 3 to 5 million down to right around 100,000, probably around the $95,000 mark for that FTE, because the IDD mobile crisis response teams would be in the 988 bill that we just did. Do I have a second on the amendment? Seconded by Representative Epley. Questions or comments on the bill? Or the amendment, excuse me, not the bill, the amendment. Representative Parker?
Do we have the text of that, or can it be put up on the screen, Madam Chair?
Yeah, I'm sorry,
Sorry,
Scott.
I'm making Scott do more work here.
Madam Chair, I will say that I did not separate this from anything else you and I may have discussed on this bill. So I would need a second to separate those if you do not want the other portion of that to be publicly displayed.
Okay. This is just one amendment, Scott, right? The way I explained it?
What you have explained so far, yes, there was, I'm in kind of a difficult position. I don't want to reveal what else we may have discussed on this bill if you are not ready to.
Well, okay, go ahead, Representative Parker.
I didn't necessarily have a question. I just wanted to make sure I was seeing the text.
Well, no, and I want everyone to feel like they're getting all the information that they need before we advance on a bill.
Scott, if the next amendment from Representative Landwehr is Medicaid expansion, can you just blink twice?
Scott's going to hide his head. That's what he's doing. He says, I know better. Okay, this reads, the Kansas Department for Aging and Disability Services shall employ one full-time equivalent position in the unclassified service to monitor the implementation of the Mobile Crisis Services Program. Then we have D, the provision of mobile crisis services shall be funded by expenditures from the 988 Suicide Prevention and Mental Health Crisis Hotline Fund established by 2021 House Bill 2281, or any other special revenue fund established by similar legislation passed by the legislature enacted into law during the 2021 regular session of the legislature for the remittance of fees charged for the establishment of a 988 Suicide Prevention and Mental Health Crisis Hotline. Any costs related to the administration of the program, including the full-time equivalent position described in Section C, shall be funded by the expenditures from such fund. If no such legislation is passed, then the provision of mobile crisis services shall be funded by expenditures from an appropriate state general fund account or special revenue fund of the Kansas Department for Aging and Disability Services designated by the Secretary for Aging and Disabilities, also known as, it doesn't say this here, but that's also KDADS for those that aren't familiar with it. Representative Epley.
Madam Chairman, just for the sake of explanation, again, I want to make sure everybody understands this is going to save SGF in the amount of how much?
It doesn't say in the bill how much because we don't normally put salaries in there, but the fiscal will probably come back at about $95,000 a quarter to KDADS because that's what they had. If you looked in the fiscal note that was with the bill yesterday, I believe the amount was actually 93, so that's why I say it's around the 95,000 mark. But that's in the fiscal note already.
And I understand that. I just want to make sure the committee understands. But the balance of the costs are borne by the 988 bill that we just passed out.
Yes.
If it gets passed by the committee as a whole.
Yes.
So that will save SGF how much money, Madam Chair?
Between $3 and $5 million.
Thank you.
Okay. Are we good? And he does have that up on the screen for those of you that have your computers. The amendment I just read.
Yes, and this includes the entirety of what you read. I'm sorry, I didn't know you were including the subsection D language in your discussions at this point.
Yes, no, that's fine. No, I appreciate you protecting me from myself. I need that sometimes. Any further questions or comments? All right. Do I have a motion on the amendment? We haven't done the amendment yet. All right. So you seconded it. All right. No, but you seconded it. I did. All right. Motion on the amendment by Representative Landwehr, seconded by Representative Epley. All those in favor signify by saying aye. Aye. Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. Back on the bill. Representative Epley.
Madam Chair, I would like to move that we pass out House Bill number 2373 as amended to the floor.
Is there a second? Seconded by Representative Parker. All those in favor signify by saying aye. Aye. Opposed, no. Ayes appear to have it. Ayes do have it. Motion carries. All right, committee, the good news is we've got no more bills to advance at this time. Do pay attention to what you might hear on the floor. We still have a possibility of maybe one more bill, but we're not sure whether it will happen or not. We have to, for the freshmen, so they understand what we're doing is all of the bills that are in our committee that are non-exempt, which right now the only ones we have are non-exempt, have to be out of our committee by Friday. So as of now, we're showing all the bills that have been intended to work at this time are out. So we will not be meeting tomorrow unless all of a sudden something comes up on another bill and we have to do that, which would also mean we may have to meet on Friday. So just kind of keep your ears open to any announcements. We would make it on the floor, and I'd make sure that Dave got an email out to all of you. So thank you for all of your hard work. I know that some of this has been a little bit confusing, and because I know that as I've worked on it of several hours a day, in some cases, it's hard to follow the bouncing ball, but the dots do line up, and always feel free to reach out to myself or in this case here on this big bill today, KDADS is a great resource for it, and we'll make sure that you get the answers. I don't want anyone to feel like they're not getting answers on the bills that we work. So we're adjourned.